GNAO1-related disorders are rare genetic conditions which are characterized by varying degrees of language and motor developmental delay, movement disorders. In half of the patients, more or less, there's also epilepsy, and they tend to have also feeding difficulties. And among the movement disorders, dyskinetic crises are a hallmark of the disease, and they are, in some patients, extremely difficult to manage. In some children, they even require the implantation of a deep brain stimulation device. And to better understand this key aspect of the disease, we conducted a Delphi consensus with other experts to better know this hallmark part of the disease. In this context, we developed two caregiver surveys, one focused on dyskinetic crisis and the other one in the decision-making process surrounding DBS implantation, with the goal to complement our clinical and scientific knowledge with the first-hand perspective of parents and caregivers, which are the ones who deal with these aspects of the disease in their daily life. Yes, with the support of the ERN-RND and the collaboration of colleagues across Europe, we were able to design and distribute the surveys in 5 European Union languages, and we received 26 responses for the dyskinetic crisis survey and 11 responses for the DBS survey. The collected data provided valuable insights into how dyskinetic crises affect daily life and into the experience and perceptions that families have during the DBS decision-making process. These findings will serve as a foundation for clinical recommendation as well as for the development of informative multilingual materials for families. One of the most striking findings was the emotional complexity behind the decision to proceed with DBS. While it is a medical intervention and decision for families, it also involves deep emotional and long-term reflections. The results highlighted the importance of enhanced communication and psychological support throughout this process, which is not always prioritized in clinical settings. We are currently working on the dissemination of multilingual informational flyers for families, covering both the dyskinetic crisis and the process surrounding DBS implantation. And the next step is to develop comprehensive clinical guidelines, integrating both the medical or scientific findings and the perspectives and experience of families. The ERN-RND has been instrumental in enabling collaboration across European centres. It has allowed us to build networks, to share expertise and to develop joint projects that combine clinical knowledge with the voices of families. Without these networks, such a multilingual, multi-centre and family-centre approach would not have been possible.